Hi and warm welcome to this educational video in which we are going to shed light on the important topic of how to effectively deal with prostate enlargement and avoid any potential complications resulting from it. An enlarged prostate, which is medically termed as benign prostatic hyperplasia (BPH), is a health condition that a majority of men encounter, particularly as they age. It is important to note here that this condition is not cancerous. However, it might cause discomfort, and if not treated, may lead to serious health complications. In this video, we will talk about a variety of causes of prostate enlargement, reveal a multitude of different methods that can prove effective for its management, and offer prevention tips that can keep you safe from developing any additional complications related to this condition. Section 1. Background of prostate enlargement, or benign prostatic hyperplasia (BPH). Benign prostatic hyperplasia is a non-cancerous growth of the prostate gland and refers to a medical condition. This particular growth is considered to be a normal component of the aging process in men and can cause the prostate to squeeze the urethra, thereby resulting in a series of urinary issues as well as complications. Although the precise reason behind BPH is yet unknown and not well classified, it is largely believed that the hormonal alterations and changes that occur as a part of the aging process are believed to play a significant role in causing this condition. Increased estrogen levels in the body, coupled with a drop in testosterone levels, can possibly lead to an enlarged prostate and cause many related symptoms that can impact a person's health and comfort. The prostate is a gland that surrounds the urethra, tube that carries urine from the bladder. As the prostate grows larger, a condition called benign prostatic hyperplasia, it can obstruct the flow of urine. Obstruction can result in symptoms such as frequent urination, slow start or stop of urination, and a weakened flow of urine. Section 2. Symptoms of prostate gland enlargement. Prostate enlargement leads to a number of symptoms that interfere with daily life. The following are the symptoms. 1. Urinating frequently. Men with benign prostatic hyperplasia (BPH) experience frequent urination, including nocturia. The urgency results in loss of sleep and impacts daily function and quality of life. 2. Weak or intermittent urine flow. Weak or interrupted flow of urine is a frequent symptom of BPH, and this is uncomfortable due to incomplete emptying of the bladder. 3. Inability to start micturition process can slow down urination, which is both inconvenient and bothersome. 4. Urgency in dribbling competence. You might find yourself unexpectedly caught off guard by an intense and urgent need to relieve yourself, prompting a strong desire to urinate. Additionally, it is possible that you could experience some degree of leakage or dribbling of urine after you have already completed the act of voiding. 5. The process of incomplete bladder emptying. Men who have BPH might feel as if they have not emptied their bladder completely, and they feel a sensation of fullness. Section 3. Various complications that can arise due to prostate enlargement. Uncontrolled BPH can be associated with severe health and quality of life implications, like 1. Urinary retention. An enlarged prostate will obstruct the flow of urine, leading to acute urinary retention, will impede the bladder from fully emptying, and will cause severe discomfort, hence constituting an emergency situation in need of immediate medical attention. 2. Stones in the bladder. Chronic urine retention may cause the development of bladder stones, and these result in infection, pain, and obstruction. 3. Renal injury. Chronic urinary retention, if it is not treated or addressed accordingly, can result in very severe and serious complications, one of the most alarming being damage to the kidneys. The kidneys get damaged due to their overstraining as a consequence of the high pressure developed within the urinary tract. 4. UTIs can predispose to UTIs by causing incomplete emptying of the bladder, which serves as a medium for bacterial growth. 5. Injury to the bladder. As time goes on, the stress that is caused by an enlarged prostate can cause a weakening of the muscles that are associated with the bladder. This weakening can then cause severe urination problems, and these problems can persist even after undergoing many forms of treatment for the condition. Section 4. Successfully treating and managing prostate enlargement. Effectively, enlarged prostate is a frequent condition in older men, yet the majority of treatments can alleviate symptoms and avoid complications, such as lifestyle modification, medication, and surgery. 1. Changes to one's lifestyle. Changes in lifestyle can be used to manage the symptoms of BPH, including, it is advisable to restrict the intake of fluids in the hours leading to bedtime in order to effectively reduce the number of times one would need to urinate during the night. Timed voiding. Regular trips to the bathroom at fixed, predetermined intervals can significantly reduce the feeling of urgency and enhance overall bladder control. One is advised to limit the intake of alcohol and caffeine, as both are well-known irritants to the bladder, making a person frequently feel the need to urinate. By eliminating or at least reducing the intake of such types of beverages, it is possible to significantly reduce the bothersome symptoms of an irritated bladder. Weight management. Obesity and being overweight are risk factors for BPH. Symptom reduction can be achieved through weight loss by diet and exercise. Stock footage idea. Older man drinking water daily or walking in a park for exercise. 2. Drugs. Medications can alleviate BPH symptoms by relaxing bladder and prostate muscles or shrinking the prostate. Some of the most common medications are alpha blockers. These particular drugs work by making the muscles found within the bladder and the prostate relax, which ultimately brings about a more relieved and comfortable feeling when urinating. Alpha reductase. Inhibitors function by effectively reducing the prostate size through the inhibition of the growth hormone. However, it must be noted that these medications take several months before their complete effects can be observed. Combination therapy. Doctors can prescribe a combination of alpha blockers and 5-alpha reductase inhibitors in an effort to successfully treat and alleviate the numerous symptoms of the disease. 3. Minimally invasive procedures. If medication and lifestyle changes are ineffective, a number of minimally invasive treatments can be employed to manage BPH, such as transurethral microwave therapy. TUMT kills excess prostate tissue with heat, relieving pressure on the urethra. Transurethral needle ablation. TUNA is a procedure that utilizes radiofrequency energy to safely shrink and reduce prostate tissue. Laser therapy. Laser technology can be readily utilized to remove excess tissue from the prostate, thereby improving and clearing the path for the enhanced flow of urine. 4. Surgical procedures. For very severe BPH, surgery can be used to remove a portion of the prostate tissue to reduce blockage. The most frequently used procedure is transurethral resection of the prostate TURP, which enhances the flow of urine by eliminating excess tissue. Section 5. Prevention strategies for complications of prostate enlargement. Of complications of prostate enlargement involves active intervention and ongoing control of the symptoms. The preventative interventions include 1. Conducting regular inspections. Regular consultations with a certified doctor for prostate checks enable size changes to be monitored and permit the early identification of potential problems. Early identification and the respective treatment of the issues at hand prevent any subsequent complications from arising in the future. 2. Prompt attention. If the symptoms of BPH are disrupting the day-to-day life, then the treatment should be initiated on time. If not treated, they can lead to severe conditions such as retention of urine or even kidney damage. Older adult consults with doctor regarding initial treatment choices. 3. Encourage and promote a well-being lifestyle. Healthy living includes frequent exercise, good nutritional supply, and good hydration. These all prevent complications in health. Avoid excessive alcohol and caffeine and attempt to be at a healthy weight in order to maintain good control over prostate health. Conclusion. Lastly, one must consider that prostate enlargement, or as it is medically termed, benign prostatic hyperplasia, or BPH, is a condition that typically affects aging men as they progress through the various stages of life. Thankfully, however, it is indeed possible to very effectively manage the symptoms of this condition. If the right and appropriate management approach is being followed, one can significantly reduce the pain and prevent any other complication from arising as a result of BPH. A variety of disparate approaches, from lifestyle modification to the use of medication and, where appropriate, the use of minimally invasive treatment or even surgery, must be employed to enhance better prostate health and quality of life in general. One must fully commit to living a healthy lifestyle, attending routine medical checkups, and receiving early treatment in order to effectively manage the condition of an enlarged prostate and prevent any likely further complications from occurring. We would like to express our sincerest gratitude to you for taking your time to view this video. If you found the information we presented helpful and useful, we kindly request that you please like this video, subscribe to our channel, and share with others. It is very important that we continue to take care of our prostate health and lead an active lifestyle together. We truly look forward to seeing you again in our future healthcare videos, where we will continue to provide worthwhile and useful information for your behalf. Please be sure to keep yourself safe, take good care of yourself, and really enjoy your retirement to its fullest.